Brace yourselves. Today, the top things I would never do as an ER doctor. Gnarly firework mishaps, the most deadly foods, and a surprising wintertime necessity. Oh my. Today, we're breaking down the top things you'll never catch me doing as an ER doctor. Stick around, you might just want to learn how to avoid a trip to the hospital or worse. All right, let's dive right in. Number 1, ride a motorcycle without a helmet. Even if you're the most careful rider, crashes are unpredictable and your body is no match for high-speed impacts. When a crash occurs, the head often takes the brunt of the impact, leading to skull fractures, concussions, and traumatic brain injuries. However, it's not just head injuries that we see. Broken bones are another frequent injury, with fractures to the femur and wrists being common due to riders' instinctive reaction to brace for impact. In the ER, when we assess the injuries, head injuries often call for CT scans to assess for internal damage. Severe TBIs might require emergency brain surgery to relieve pressure or repair fractures. The road to recovery for motorcycle injuries is long and grueling. Patients often face months of physical therapy and in some cases, permanent disability or even death. This is why wearing proper gear isn't just a suggestion, it's essential. Have you ever known somebody or been in a crash yourself? Let me know in the comments. 2, holding on to fireworks too long. Holding on to them for too long can turn a celebration into a nightmare. I've treated so many patients who've suffered from severe burns and mutilated or missing hands because they underestimated the danger. When a patient comes in with firework injuries, we first address any life-threatening conditions like significant blood loss or shock, and severe cases might require surgical interventions like grafts or reconstructive procedures. For some, the damage is permanent, so please do me a favor and leave the fireworks to the professionals. 3, use gasoline to start a barbecue. Gasoline vapors ignite rapidly and can cause explosive fires. We're talking 2nd and 3rd degree burns that cover large portions of their bodies. In the ER, burn victims are stabilized first by managing their airway and circulation, and then also managing pain and preventing infection. We then use specialized dressings and sometimes transfer severe cases to burn units where they can receive advanced care like grafting, or shoveling snow if you have heart issues. This seemingly common chore can be deadly. The combination of cold weather and intense physical exertion places a huge strain on the heart, significantly increasing the risk of heart attacks. Immediate care involves stabilizing their heart rhythm and administering medications like aspirin or nitroglycerin. And if a heart attack is confirmed, we'll often perform emergency interventions such as placing stents to restore blood flow or conducting bypass surgery in severe cases. So if you're one that may have pre-existing heart conditions, my advice would be to ask the neighbors, kids, or a local service to help you out with the shoveling. Speaking of recovery, another thing I'd never do, go without good sleep. Your body does its best healing during rest. And if you're struggling in the sleep department, check out Do Not Disturb by my company HuffPost. It's packed with magnesium, L-theanine, and other natural ingredients to support restorative sleep. Head to lifehappens.com or Amazon to learn more. 5, eat fugu. Now, this is a Japanese delicacy made from pufferfish. Fugu contains tetrodotoxin, a poison that's 1,200 times more toxic than cyanide. A single mistake in preparation can lead to numbness, paralysis, and even death quickly. If someone came into the ER with tetrodotoxin poisoning, we focus on supportive care, such as ensuring the patient's airway is open and managing symptoms like low blood pressure and difficulty breathing. And since there's no known antidote, survival often depends on early intervention and the body's ability to metabolize the toxin. It's simply not worth the risk for me for a taste of adventure. If you're curious about other deadly foods, I did a whole video series on it before. I'll put a link to it in the description below. 6, jump into unknown water. I love swimming, especially in the warmer months, but this fun water activity can quickly turn into tragedy when people jump into water without knowing what's beneath the surface. I've treated patients who hit submerged rocks, suffering spinal cord injuries, or even broken necks. When a patient comes in with a potential spinal injury, we immobilize them immediately to prevent further damage. And recovery often includes physical therapy and learning to adapt to life with paralysis. So just make sure you pay close attention to where you are swimming before you just dive into the deep end. Have you ever had a water time snafu? Let me know in the comments. Number 7 thing I never do as an ER doctor, ignore chest pain. Chest pain is one of the most common symptoms that patients brush off, but it can indicate serious, life-threatening conditions like heart attacks or aortic dissections. In the ER, if someone comes in with chest pain, we assess it with EKGs, blood tests, and imaging to rule out things like heart attacks. Treatment might also involve blood thinners or even emergency surgery, depending on the diagnosis. Quick action is key to minimizing damage and improving outcomes, which is why you should never ignore chest pain. It's better to be safe than sorry. Number 8, deep fry a turkey indoors. It may seem obvious, but hot oil is incredibly dangerous. A single splash can cause second-degree burns, and a full-on spill can ignite fires, destroy homes, and lives. In the hospital, burn victims are treated with a focus on pain management and infection prevention. Severe burns may require specialized wound care and, in many cases, surgery to repair damaged skin. Preventing these types of festive injuries is as simple as deep frying turkeys outdoors with proper precautions. Have you ever deep fried a turkey? Let me know in the comments. 9. Using a water yard type of slide as an adult. Lawn slides might seem like harmless childhood fun, but as an adult, the risks are far greater than you may initially think. I've seen patients come in with head injuries and even spinal cord damage from hitting the ground too hard or crashing into other people. In the ER, these patients often require imaging to rule out fractures and other body damage. Severe spinal cases may involve surgery or rehabilitation. If you're tempted to join the kids, my advice is to check the yard first and stick to safer, even ground before diving in head first. 10. Skip a seatbelt. A seatbelt is a must. I myself survived a rollover car accident from being seatbelted in. When a patient comes in from a car-related accident, we always ask law enforcement or paramedics for more information or any photos. It helps us better assess potential life-threatening injuries, from spinal fractures to internal bleeding, and treatment can involve surgeries, imaging, and weeks or months of recovery. Based on what I see in the emergency department, seatbelt-related injuries are far less severe than those who are not buckled up, making it a simple yet effective way to stay safer on the roads. 11. Carry a gun in a belt loop. I can't stress this enough. Carrying an unsecured gun in your belt loop is incredibly dangerous and stupid. I've treated a number of patients who accidentally had gunshot wounds caused by improperly securing firearms in this area. And these injuries range from soft tissue injury, missing genitals, aka shooting things off if you catch my drift, and even life-threatening organ damage and arterial bleeding. When someone comes in with any sort of gunshot wound, our first priority is to control the bleeding and stabilize vital signs. Depending on the location of the injury, surgery may be required to repair damaged organs or remove the bullet. And just so you know, law enforcement is always called when there's a gunshot wound to the hospital. 12. Drinking and driving. Drunk driving doesn't just harm the driver. Innocent passengers and other drivers are often the victims of these completely preventable tragedies. I've treated patients with shattered bones, traumatic brain injuries caused by these type of drunk drivers. In the ER, drunk driving victims often require a multidisciplinary approach to care. We stabilize them, address fractures with orthopedic interventions. For survivors, the road to recovery is often long and painful, involving surgeries and months of rehab. Prevention is simple. Don't drink and drive, ever. All right. That's a partial list of things I'd never do as an ER doctor. If you'd like to hear more things based on what I treat in the ER, let me know in the comments below. Hopefully, you're now thinking twice about some of these risky behaviors. If you've had a close call with any of these, let me know in the comments too. And if you found this video informative, please check out this playlist right here and subscribe, hit your like button, and turn on those bell notifications. Thank you so much for watching, and stay healthy, my friends.